Okay, so once more, thank you everybody for showing up within a short notice. It is the first of its kind that I'm doing. I hope it works well because if it works well, I can be doing it every month, every 2 months, every 6 months. It will depend on the outcome and if a message will go through with this first edition. So as I said, the idea came because of the fact that we don't have community life. We are not too informed, and some of us have the luck to be exposed to information. Some of us have the luck to read, to search information aggressively, and without being greedy, I decided to share the little that I the little that I have grasped along the way, knowing fully well that it can help somebody in one way or the other. So the title of this webinar is Building a Strong Brand, Launching Your Healthcare Practice, a Roadmap to Success. Why building a strong brand? Building a strong brand means you've gone through all the hurdles of the business and now you have a brand. You are placed in a position that when you sit in a crowd where people are practicing your business and you call the name Inspire Consulting, at least one or two people will know. For example, meaning you can have a business without having a brand. You can have a business and stay at a very lower level. So the goal is to educate people about going into business, specifically healthcare, which is what I master. Unfortunately, if I knew other types of businesses, I could have also had a session on that, but I focus more on healthcare, specifically mental health. Well, other I also have experience with other healthcare sectors, but my specialty per se is mental and behavioral health. So my name is Zukane Mbui. I'm the CEO of Inspire Consulting, and I kind of have a diverse background. I initially had my previous master's in international relations and international development, and before then I had a 3 years diploma in counseling. But the story is that I never loved being referred to as a counselor. But unfortunately, when I came to the US in 2019, I happened to have my first job in the mental and behavioral health industry, and which kind of correlated with my counseling background. So what I abandoned back then, I found myself doing it again. And I've continued in that light. Right now, I'm an addictions counselor, and I'll soon be a clinical psychologist. So I think the number is huge for us to be doing self-introduction. So I crave on your indulgences to write your names, your title, and phone number, email address in the chat box. You can send it individually if you don't want to share with the group, or you just share it with everybody. But I'll advise for us to share it with everybody because part of the goal of this webinar is networking. We have a diverse background of people here. When I look at the participants, we have people, we have medics, we have non-medics, and it's kind of mixed. We have managers, we have case managers, we have project managers, we have certified addictions counselors, as well as we have renowned investors in the healthcare. So in the subsequent sessions, we bring in speakers. I already know of a confirmed speaker, Dr. Gore, who is uh he's a psychologist. He's a psychologist. He'll be speaking. I also have a friend who owns a business that is not in the healthcare, who decided to develop the interest to come and talk about businesses because he's so successful in what he's doing. So without further ado, I'll share my screen.
This is really good, like for reading right here.
Please mute yourselves if you don't have the floor. All right. Without further ado, I will share my screen so that you'll see you'll see the outline of the webinar tonight. I'm sure you can see my screen. Yes, you can. Yeah, so this is so as I said, I think we are done with the first part, which had to do with introduction. We'll not have time to introduce everybody, but please write their names in the chat box so that we can use it for follow-ups and to continue with the networking, which is part of why we are here. So I'll move straight to the objectives and expected outcome of this webinar. The the objectives is for people to understand the current landscape in healthcare. There are a lot of changes that came in since November of 2023. No, November of 2022. There are a lot of changes that came about in the healthcare sector in 2019 with the advent of the COVID. There are a lot of changes that came about in the healthcare sector in July 2004 with the advent of social media, specifically Facebook. So each day, the trend is changing. Things are changing because of technology specifically and other economic, socio-political factors that may interplay. But right now, we are in a new era. This is post-COVID era. Before, the main concern, the main orientation of healthcare was around COVID. Later on, in November 2022, when OpenAI was made public, things changed again because the attention drifted away from COVID to artificial intelligence. So those are things we'll talk about. Those are things you need to take into consideration. And then at first, healthcare was more of top down, where the medics or the clinician will impose what they want on the client. But I think in the early 2000s, the trend changed where it became person-centered. It is the client that orientates the direction of the treatment because they are the ones feeling the pains. And we'll talk a little bit about preventing care practices and wellness programs. Now, the second part of this webinar has to do with opportunities and challenges in the US healthcare sector. And I'll stay a little bit longer here. I'll stay a little bit longer here because this is like the kickoff of the webinar. So many people, I think almost everybody here, with the exception of some few, is here because they have a lot of questions in their mind. I have this money saved in my bank account. I've been doing 9 to 5 for 10 years. I have hundreds of thousands in my bank account, but I don't know what to do with it. I don't know where to start. I've been saving, and as somebody who falls in the E quadrant, I don't know what to do. I also want to be a millionaire. How do I go about it? So many people have those questions, and those who have the ability to take the risk will go and see somebody, maybe a consultant. And if you fall in the hands of a good consultant, fine. Sometimes you fall in the hands of a consultant that cannot really help you, a consultant that is just somebody who was helped along the way and decided to be doing it for other people without even knowing what the compliance states, without ever writing a policy and procedure. So if you have that in mind, that perspective in mind of being tired of doing your 9 to 5 or having money stocked somewhere, saved somewhere, and wanting to do a business, if you have that in mind and you don't know where to go, you are the right place. You are at Inspire Consulting. That's essentially what we do. We've transformed so many ideas into businesses. We've created license across many states. DC, Maryland, Delaware, North Dakota. We are venturing in California and other states. So what I'm trying to say is, if you are based in any state in the US and wants to operate a business, just get to Inspire Consulting. If we cannot do it, we'll lead you to resources that will help you. But I am not sure there is a state that we cannot venture in and get you a license. If there is a state that we cannot get you a license, know that the license is not opened. Now, if you have that idea of starting a business and do not know opening a healthcare and do not know what to do, the first thing I'll advise you do is create a business. Even if you don't have the money to lodge it in the business, just create a business. Once you have a business, you have that urge to lodge something in the business. And secondly, well, just to confirm that point, necessity will always be the mother of invention. If you create it, say in Maryland, and at the end of the year, they ask you to pay $300 of tax without you making any dime, next year you would think of what to do to at least get $300 that you pay for the taxes. Now, I'm talking about taxes. The next advantage of having a business is it can help you when filing your taxes. If, for example, you work 9 to 5 and you make about 150 and you own a business, that business can absorb about 50,000 when you're filing your taxes. What do I mean? What I mean is there are certain expenses, especially, it's conditional though. It is in a case where you went not as an employee, but as somebody in a business. It works well with people doing 1099 more than those doing W2, because with W2, you are directly linked with the um, with the company. But if you're a 1099 contractor, I advise you today, please create a business and use that business. Ask your employer to be paying you through the business. It will help you a lot in taxes because the business can absorb a lot of expenses. You can put all your feeding as, business dinner. You can put your flights as business flight. You can put your transportation under the business. You commute in between your business, your job site, and your house, things like that. So the business can actually absorb a greater proportion of of your expenses, which will help you with your taxes. But please don't cheat. Now, what are the types of businesses in the US? Uh, I'll apologize. I did not do a PowerPoint presentation because I wanted it to be more of a conversation. But the way I'm saying, in the next session, I'll do a PowerPoint presentation, which I'll share with all the participants. Or what we can do is once you send your names and your emails in the chat box, I'll send the PowerPoint presentation to you. I have another PowerPoint that I developed, but it was not with this. So I can send the PowerPoint to you if you're interested. But in my mind, I just wanted it to be a conversation or at least an introductory session where I'll share with participants what I want. Now back to business. So what are the types of businesses in the US? There are different types, about 5 or 6, but we'll talk just about few. It is good to know the form of business that you want to venture in before you start. And whether you're a 501(c)(3), whether I want to do home health, whether I want to do mental health, whether I want to open an ambulatory healthcare, or whether you want to do charity, whatever, you must first of all own a business. So owning a business is a must go. If you want to do you want to obtain any license, you must first of all own a business because that license will generate income. And that income should have its own social security in code. That business should have its EIN. The employer identification number is a social security of businesses. So if you want to get a license to operate as a mental health, uh, home health, whatever, you will need a business that will have an EIN with the IRS. That's how you'll be communicating with the government. So for you to even think of doing whatever healthcare business, healthcare service, to provide any healthcare service, you must first of all get a business. As I was saying, there are various types of businesses. It depends on what you want. It depends on your vision. It depends on your resources. It depends on where you are going to. The most basic is a sole proprietorship. We all know in basic economics that is one-man business. Somebody just sits and decide to do his business. It is the easiest form of business to create because you don't have all the paperwork involved with the other forms of businesses. You just need to have the idea, sit somewhere, go to the licensing body, and you create your sole proprietorship. Now, with each form of business, I'll give the advantage and the disadvantage. With the sole proprietorship, the advantage is that it's easy to get. But the disadvantage is that you are liable for the business, meaning you are mixed with the business. In case, God forbid, you are bankrupt, know that they will come even for your laptop. They will mix your personal belongings with the business. Whatever you own, they will come for it. That's the disadvantage of being a sole proprietor. Is there any question for me? All right. The next is partnership. Partnership is where two people or two moral entities, a business and a business, can come together to form partnership. Mr. and Mrs. can come together to form partnership. Two friends can come together and form partnerships. Why not two enemies and form partnership? So it's about two people coming together in a defined condition to create a business. So you are the ones to decide who should own a majority. Is it 50-50? Is it 30-30-40? Is it you decide on the the share that you are bringing in? Meaning the more the share you have, the more the liability you have. In case your rent is $1,000 and it's 60-40, it means you pay $600 and your partner 400. In case the business makes $10,000, it means you with 60% will take 6,000 and the other 4,000. The next form of business, which is the most popular in the US, which is the most recommended, is limited liability. It's limited liability companies, LLC. LLC LLC is the best because it picks the advantages of it mixes the advantages of the others. It's like um the best route for a startup. What's an LLC? An LLC simply is a business where the liabilities, when you talk of liabilities, the risks, where the liabilities of the business is limited only to the business. Contrary to the sole proprietorship, with a limited liability, in case of something, let's say bankruptcy, they will go for the office laptop, they'll spare your private laptop, they'll go for any investment that is within the scope of the business, and they'll spare you. That's why limited liability is so popular. And another advantage of limited liability is it can be a single member, it can be a single member, as well as it can have multiple members. One man can create a limited liability, as well as 20 people can create limited liability. So we have multiple members and single members in a limited liability company. And as I said, the advantage of an LLC is the fact that the liabilities of the business is limited to the business. You are always spared. Now, the next form of business, which is common amongst big businesses, Fortune 500 businesses. Well, there's some Fortune 500 businesses that are still LLC. Do you know that Google is an LLC? But it's amongst the Fortune 500 businesses. The advantage of the next is an incorporation. An incorporation means a group of people called board members comes together and create a business. An incorporation is managed by the board members, and the US system is a little bit relaxed compared to other systems that I studied in Europe, because here in the US, two people can incorporate, but in some countries, like Belgium, for example, where I lived for a while, you must be at least five people to incorporate. So incorporation means a group of people called board members decides to make a business. And in that case, they decide on the shares, who should own what, who should be who. There should be a board chair, there should be maybe a president, there should be the financial secretary and all the light. You must have that structure. There must be a board when it comes to an incorporation. Now, the disadvantage of an incorporation is similar to the disadvantage of a limited liability company. In case, God forbid, of bankruptcy or something, a risk, they will go for the resources of all the members of that incorporation. They will not spare any of them. Now, the advantage of an incorporation is the fact that you can go public. Tomorrow, if you grow big, you can go to the New York Stock Exchange and be selling shares to the whole world. That's the advantage of an incorporation. Another advantage is the more you are, the lighter it becomes. Though the more you are, the more problems you have to face. So those are the different types of businesses. If you want to create a business, you think of one of those. As I said, the most renowned, the most popular, the most used is a limited liability company. Another advantage of the limited liability company, I wanted to go to incorporation before coming back, is the fact that you can elect to be an incorporation. Though you're a limited liability company, it's confusing, but I'll break it down. You can be a limited liability like Inspire Consulting and elect to be an incorporation like Inspire Consulting. As such, where whatever is an advantage with an incorporation, you can benefit from, and whatever is an advantage of a limited liability, you can benefit from. To have that status, you need to apply to the IRS that you elect to be an S corp. If you create your LLC and you think you have that vision to grow big and wants to tap on the advantages of an incorporation, just compile your documents to the IRS and tell them that you elect to be an S corp. S stands for small corporation. As such, they'll give you that special status where you are kind of on the fence. If there's a disadvantage with incorporation, you say, no, I'm an LLC. If there is a disadvantage with LLC, you say, no, I'm an incorporation. So you kind of balance along the way. So I advise that the best form, I'm not imposing on anybody, I'm just sharing my best practices. The best form of business to go for is a limited liability, because you can do it alone as well as you can do it with multiple members. And then later on, you can elect to be an S corp, which gives you that mandate to operate as an incorporation. Are there any questions about the forms of businesses that you can create if you intend to create a business? Are there any questions?
What is the difference between limited liability and LLC?
LLC is just an abbreviation of limited liability.
Oh, okay.
It's the same. So,
Hey, I have a question too.
yes.
Yeah, I have heard people say that sometimes they want to create a business, they do like a trust and register the business under a trust to kind of offer some level of protection in case something goes wrong. I don't know, I'm not informed about that, but I've heard people talk about that. Can you shed some insight on that?
Yeah, a trust generally has to do, it's mostly when you want to insure your business and when you want to make it sustainable. Trust generally is it's not a form of business. It doesn't fall in this category. It is when you already have your business and you need protection, you need insurance, you need the business to be generating benefits from within, that's when you go for a trust. But at the beginning, there is no form of business that is a trust. So a trust is just something that comes when the business is running already. So you cannot create a trust at the beginning. So those are things that comes along when when you are growing big and you want to you want to secure your business, going for a trust. But what we are saying right now is when you want to start, how do you start? What are the options to start with? It is just around what I've said: sole proprietorship, partnership, limited liability, incorporation. That's it. So those are the different types of business that you can start with. Later on, when you grow big, you can opt for and any other thing that can protect your business, that can make it more sustainable. So it's not a form of business. You cannot start with a trust without at least having a form of business at the beginning. I don't know if I've answered your question. Okay.
Yes, you have. Thank you.
All right. Thank you. Now, let's assume you've created this business.
Quick question, Mr. Zhu.
Yes.
Yeah, about the S corp, because I know to start the S corp or to convert your company to S corp, you need to be a US citizen. Is that true?
Very wrong. Very wrong. I'm not a US citizen, but I had my S corp 1 year after my business was created. I think those are the things that were being relaxed with the tax reform of 2017. When President Trump came, he did a lot of reforms, and I think these were some of the reforms that were being done. Even being a CBE, a certified business entity, at first, it used to be reserved only for US citizens. Those were relaxed. My company is a CBE, it's a certified business entity. My company is an S corp. I'm the sole member, and I'm not a US citizen. So those are just
So
those are
before
just
it was one of the requirements, right?
yes.
To be a US.
I think that was the case before. I'm not so sure, but that was the case before. But I think the third major tax reforms in the US was done in 2017 by President Trump, who did a lot of reforms that kind of favored immigrants, though there are still some, institutional discrimination against immigrants, but it's not as glaring as before. For example, a non-US citizen cannot be SBA certified. SBA is Small Business Administration. Once they give their certification to you, they give you small contracts, even if you apply or not, because those are protected category. And for you to be SBA certified, you must either be a woman-owned business, you must be a disadvantaged business, you must be somebody that is struggling. And once you have that protection, sometimes they will just, reserve some contracts to SBAs and share the resources to them. So those are some of the things that needs to be adjusted to favor some of us, but there's certain things that an immigrant will not benefit from. But in general, it's far much better before 2017. Trust me. I was not here in 2017, but I have the information that it was really strict. Like somebody just said, an escort was reserved for US citizen. Maybe that was
Yeah,
the case
because
before.
I know that because we tried to convert from LLC to S corp, and that was one of the requirements, but we managed afterwards. So that's why I was just putting that in
Okay.
place.
No, it's no longer the case because I have one. I can even share my escort if you want to see. And I'm
Oh,
not a
that's
US citizen. So
mm.
things have changed.
Okay.
Things
All
have
right. Thank you.
changed. Yes. And I just want to precise something. You don't convert, you just elect to have that extension. You still remain an LLC, but with the S corp status. So it's just a status that is being given to you by the IRS, and it's not just given. So many people apply and don't get it. That's something that if you want to do, you need to contact us so that we help you. Well, business aside, now Let's assume you've created one of those businesses. You've decided that I'll go for sole proprietorship and I want to open a mental health agency. What should you do? I think that those are some of the questions that we are having in our mind. What should we do? What should I do? I have this business that I've created. I'm paying $300 to the government of Maryland. What should I do with it? It's 2 years and I've done nothing. That's where you should start thinking. And that's what you should start before even thinking of creating a business. I'm about to create a business, yes, but what am I going to do with the business? You need to answer those questions before creating a business. Else, you'll be spending money for nothing. Or, well, except you want to evade taxes, you want to, cut down on the burden of taxes. But you always need to have that questions in mind. They always say the 4 W's H. Who, where, what, when, how. Answer those questions before jumping into a business. And before you even think of what you want to do, there are certain things that you need to take into consideration. First and most important is your passion. Do you like what you want to venture in? If you don't like it, please go next door. If you don't like somebody who is depressed, you don't like to see somebody who is alcoholic, who is always high on drug, don't go into mental health because those are your potential clients. If you are somebody who doesn't like to be around a home, who is antisocial, who doesn't like to sit around people, then a home care business is not good for you. So do a mind search and see the type of business or healthcare sector that you're passionate about before you go in for. After passion, you have to think of your risk threshold. Some of us, we are risk takers. Invest even where we know it will not work, just to learn. If you know you cannot bear risks, you cannot manage your high blood, don't treat your high blood before going into business, except you want to stay this big. If you know that you want to expand, you want to blossom, then work on your risk threshold. There's some people that once they hear the name Medicaid, like me, for example, I'm so scared of that name. Once they hear the name Medicaid, they're scared. It's not a good name, but when you do it well, it's so sweet. I had to work myself for years to accept the fact that I can also do business with a Medicaid ID. I had to work on myself because my risk threshold is too small. I'm so scared. But in other sectors, like in the contract world, I'm not scared. I had almost nothing in my bank account, but I was bidding for contracts for millions of US dollars. And each time, the good luck is once they reject you in the United States, they'll do what they call debrief. Each time they reject me, the next email that will go to the contract officer is, can I have a debrief? They must say yes, it is the law. If they say no, you can sue them. They can fire them the next day if you want. Once they reject me, I'll ask for a debrief. And each time they'll say, your business is too young. You don't have the financial resource, but you can do this to get finances. You can do this to get finances. You can do that. That is it. So work on your risk threshold after the passion. And then the next thing is resources, human resource, financial resource, and social resource, networking. My strength is not money. My strength is not my strength essentially is human resource because I have the capacity to bring people together. I have the capacity to talk to somebody, sell my vision to the person, and the person works along with me. I've had people working with me as volunteers without complaining for years, like happily volunteering their efforts at the company. But in some cases, with some leaders, they will not be able to volunteer because maybe of the leadership style. So you can still be without financial resource, but capitalize on human resource. social capital, have that capacity to convince somebody to come and work with you. Tell them this is where we are getting. Be honest with them, this is where we are getting. When something small comes, you share with them. You continue to share. You can do it without paying them. Volunteering is something that is huge in the US. After the resource, if you're not somebody who reads, if you're not somebody who is curious, if you're not somebody who is bold and aggressive, then look for an expert or somebody who did it before. Don't just jump because you've seen X doing it and jump and do it. Some of us use that route because of, first of all, exposure. Before moving to the US, I was so exposed. I was so exposed. That's why it was a little bit easier for me. That might not be the case with you or with some other person. I literally did not consult any expert or consultant with everything that I did. Why? Because sometimes I sleep 2 hours, not because I'm working, because I'm reading. I'm so curious that if I see something, I'm curious and aggressive. If I see something that I have doubts about, which is at the Department of Behavioral Health, I will go there and book an audience to meet with the director and ask those questions, get it directly from the source, learn from there. That's the approach I've been using. One of my masters was in international development and policies. So writing policies is very easy for me, and somebody who is a policy writer can easily interpret compliance. So get in touch with experts or take somebody who can share the best practices with you before venturing. Don't just go because you saw somebody doing it and you jump and do it. So those are the things that you need to take into consideration. Have the passion, work on your risk threshold, get in touch with experts and people who can share best practice with you, best practices before you go into the business. Now, when you go into the business, don't just jump into the business and start. I was given $1 million US by the Bank of America, or my father gave me 500,000 US dollars. I just need to go into mental and behavioral health. No. You need to know. America is an open book. Everything is on the internet. Everything is made public. It is a system. It is something that is right there in front of you, which you can benefit. Before you even start, get a little bit of idea about what compliance states, about what the laws, the policies state on that business. Each business has a set of law that manages a business. Let me talk about mental health in DC, which I know a little bit. If you want to do mental health rehabilitation, what they have one of their chapters, which is chapter 34. Go and read chapter 34. You know what mental health is all about. If you want to do SUD, go to chapter 67, and so on and so forth. Have an idea of what their laws want. What are the groundwork that you need to do in order to step on the stepping stone. Do that research. Even if you have an expert, some people call themselves expert when they are not. Some people who call themselves expert, but they will not be able to accompany you in the process. So do your due diligence to know what the laws state around that. In Maryland, everything is embedded in the coma. And I don't even know the full meaning of coma, but I just know that all the laws is under the coma. Coma is something that's where all the laws are. Read the coma that has to do with what you are doing. Now, let's talk a little bit about the different sectors of healthcare that you can invest in. Healthcare is broad. We have outpatient and inpatient. We have outpatient and inpatient. You can see called outpatient ambulatory. The difference between an outpatient healthcare setting and an inpatient healthcare setting is just the fact that nobody sleeps in the facility. With the outpatient, they come and receive the treatment and go. With the inpatient, they always keep them somewhere to monitor them. And usually, those are critical cases or urgent cases. It's mostly critical and urgent cases that goes into inpatient because maybe a nurse needs to be taking their temperature, maybe the psychiatrist, they need to do groups and sleep on the bed for the psychiatrist or the clinical psychologist to monitor them, things like that. Oh, there is a bracket which I'll share with you that is kind of in between outpatient and inpatient. They call it waiver programs. Waiver programs, I think, came about in 2006. Let me not say what I'm not sure of. But waiver program is kind of in between. Waiver program is simply a program that extends the outpatient, usually, or a program that can fall on the side of inpatient as well as on the side of outpatient. So most of the programs that you have waiver programs. So with waiver programs, it's kind of easy to get. It's kind of easy to get a waiver license than maybe an outpatient or inpatient license. So most industries have waiver programs. Let me take, for example, in DC, the Department of Disability, most of their licenses are under the waiver program, meaning they have waived some services and they've given it to you, maybe in-home support, maybe companionship. They have waived those services that they think they cannot handle within the hospital. They give it to you to handle it within, maybe in their homes or somewhere that they might be comfortable with. So the idea of waiver was brought about to decongest hospitals because hospitals were so decongested when the Medicaid waiver program came about. So you can decide to go in for a waiver program without being an outpatient or an inpatient. And the good news is most at times waiver programs are always open. Back to business. Inpatient, as I said, has to do with something that hovers around hospitalization or where there is a bed or where there should be that close monitoring. Inpatient, I hope that's what I said. Then outpatient is where they come and receive the service and go back home, or where they deploy staffs to go and give them the services in their homes and come back. Those are the two main branches with the waiver program in the middle. Now, let's talk a little bit about outpatient because inpatient is kind of difficult. Inpatient, I'm talking about mostly hospitals, critical care centers, and so on. I think, let me not downgrade somebody, but most of us here, it needs a lot of resource, a lot of resource to operate as an inpatient. So let's focus on what we can get easily, outpatient. Now, as I said, outpatient is when you come and receive your service and leave. And most waiver programs operates similar to outpatient. They just come, receive, and go. In the healthcare, there are so many outpatient licenses that you can have. Outpatient, how do you get there? First, as I said, you need to first of all own a business before you can think of an outpatient. Own a business after you've reflected on your passion, your risk threshold, your resources, and then go in for an outpatient. How do you do that? How do you get an outpatient clinic? Difficult question because it varies from state to state. It depends on what the one in that state. As I said, once you consult an expert, do your due diligence to know about the laws in those domains. How do you get there? Usually, you need a license. You need a license to operate as an outpatient. You need a license to operate healthcare in America. You cannot just move into somebody's house and start giving them injection. If not, you give that injection and the next minute you'll be in jail. But if you have that license, to provide skilled nursing services. Go and give it, put it, write a report down, and why you went there, who diagnosed them, you are safe. So you must obtain a license to operate as an outpatient clinic. Let me not talk. I think there's a hand. Somebody, is there any question? Is there any question for me? Okay, let's continue. To start an outpatient facility, you must obtain the license. And as I said, there is no one size fits all with licensing. It varies from state to state. It varies from county to county. It varies from state to state. It varies from county to county. It depends on what the laws state. Depends on what. Yes. Yes.
Yeah. Can you operate in DC with Maryland business registration?
Yes. You can operate in DC with Maryland business registration. Thank you. That's a very great question. In the United States of America, you have the right to operate in all the 50 states, including the extended territories. You can go to Puerto Rico and create a business. You have the right to operate a business anywhere. Yes, you can have your business in Maryland and operate in DC. How? You just need to do one thing. Take your license, your business. I hope we are talking about business, not a license. Not an outpatient license, because if it's outpatient license, no. Except it's an extended program, which I can elaborate on later on. If it's a business, yes, you can create a business in Maryland, which will be your headquarters, and then have a branch in DC. My business is headquartered in DC, but I have a branch in Maryland and in other states.
Which means I'm going to need a DC. In that case, you're going to need an address in DC to start with.
Oh, no, not necessarily. You can and you
good.
cannot. You can and you cannot. So if you operate, let me continue with it. And if you operate in Maryland and want to do your business in DC, all you need to do is to carry a Maryland license, go to DC, and you will then apply in DC as an out-of-state business. You don't need an address, except it is something that requires an address, maybe a residential program. But you can use your address in Maryland to operate a business, to create a business in DC. I think Miss Marvel is here. I used my address in DC and created a business in North Dakota. I don't have an address. I've never been to North Dakota, but my business, my certificate, they gave me 2 licenses. I have a license to operate as a contractor, and I have the license from the state. And on the license, it is my DC address that is written. So you must not have an address. Yes. So what I'm simply trying to say is you can have your headquarters and then you have branches all over. Just need to tell them what they need is for you to create a tax account that you'll be paying your taxes. That's all they are more interested in. Once you create a tax account, okay, he's headquartered over there. They'll be sending all your bills there, except you have something that requires an address. Say you now want to open an outpatient clinic in North Dakota or in DC. You will then need an address because you'll be limited. Your services will be limited to DC. You cannot serve Maryland clients. You can only serve DC clients. In that case, you need an address. But you can still maintain your Maryland address while operating in that address in DC, as well as you can do whatever you want. I think I've answered your question. Any other question? Okay, so as I was saying, outpatient, for you to operate as an outpatient clinic, you need a license. And it varies from state to state. What obtains in Maryland is different from what obtains in DC, is different from what obtains in Delaware, it's different from what obtains in North Dakota, California, and so on and so forth. All the states I'm listing are the states that have, in one way or the other, either assisted or created a license, obtained a license for an outpatient. So it depends on what they want. Let me take a case that I master a little bit. Two case scenario. Let me take DC. In DC, if you want to operate an outpatient clinic, let me take mental health, and then I can talk about DDS, about disability. I don't know much about home health. I'm not too interested in that. That's why I've never researched on that. But I know a little bit much. I know so much on mental and behavioral health, and at least I know a lot, or somehow, with developmental disability. Mental health, outpatient mental health in DC. I'll talk about DC and Maryland. DC requires you to align with their chapters. Their policies are embedded in chapters. They have different chapters. It depends on what you want. If you want to operate a substance use disorder, you must align with chapter 67. If you want to obtain mental health rehabilitation program, you must align with chapter 34. So they have those laws. Now, in DC, they have windows that they open for people to apply for licenses. And after that, they close it. After some time, maybe based on resources, maybe based on changes, they'll open it again. People apply. Once they get the number that they want, they close it. So nobody knows the trend. Whether they do it after 5 years, after 1 year, after 10 years, nobody knows. But the last time it was opened in 2017 and they closed it in 2018. Since then, it is on the 1st of December 2023 that they reopen it. And nobody knows for how long it will be opened. So know about the chapter that manages it, because that's where they will tell you when it is open and when it is not open. So mental health rehabilitation in DC right now is opened. We don't know how long it's going to be opened, but it's open right now. Before the 1st of December 2023, you could not obtain that, like you could not even think of. Once you write them, they'll say it's closed. Okay. Once you know you already determined that it's opened, you need to know how to apply, what you need to get that license. Some, North Dakota, will require you to email them an application format. In North Dakota, what they need is for you to write good policies based on their laws, sent to them. If they approve it, they'll give you a provisional license. As easy as that. If they approve the written documents, they'll give you a provisional license for 1 year, and then they'll come and monitor you after to give you 2 years permanent license. In DC, you need to compile a series of documents and email it to them. In I think California, they have their platform that you can submit. In some cases, you need to mail it. So they have different means to receive your application files. Now, the next thing is you need to know what to apply, how to apply, the things you need to submit. DC, is it a question for me? Okay. DC, for example, 2017, they just required you to submit your application following the things that they want. 2023, things have changed. They require you now. MHRS is open in DC, Mental Health Rehabilitation Service. That's companies that offer CSW services. It is open right now in DC, but it is not as open as in 2017, because in 2017, once you fulfill the things that they need, you submit. Okay, if everything is okay, we plan for a site visit. If the site is okay, they give you a license, or they reject it, you send corrective action, still it's okay. That's not the case today in 2020. from the 1st of January 2023, there were changes that the Department of Behavioral Health observed. First, they require everybody to be accredited by one of the national accreditation bodies. You have the Center for Rehabilitation Facilities, CAF. You have the Joint Commission, which flows in my DNA. I've done it so many times. I simply just know it. I just know how to speak the language of the Joint Commission. I do it practically every week now, ever since MHRS was open. I do it almost on a weekly basis, sometimes two sessions a week. What is that accreditation? It means you have the tools, the best practices that meets the standard that they have in place. So these are simply things. They have EPs, element of performances, environment of care, and environment of care. Is it risk-free? Emergency management. In case of emergency, what do you do? Infection control. How do you manage your infection control? Human resource management. Do you do competency evaluation before admitting somebody? Because somebody will come, oh, I want to be a CSW, when they don't know how to type on a computer. You need to do competency evaluation to see if they meet those basic standards before you recruit them, things like that. You have leadership, how to manage. Do you have that culture of communicating with your staff? Do you need to take those things, sit in front of a panel, and defend them, show them that you can do it. After that, they might submit to corrective actions, then send you the license if you are good. If not, they'll deny you. The good news is I've never been denied, and I've done it at least 20 times, let me not exaggerate. So DC now requires you to submit an accreditation from the Joint Commission before you fulfill all the conditions. Maryland, same. This is simply copied from Maryland. Maryland is the same. You need an accreditation before you can obtain a license from BHA, from the Behavioral Health Administration. But that is not the case with all Medicaid licenses in DC and in Maryland. I will explain. In DC and in Maryland, it is when you want to do behavioral health generally that they require you to get accredited before you apply for the license. But if you want to open a clinic, say a practice in DC and Maryland, you don't need an accreditation. All you need to do is to have your license as a practitioner, or have the guts as a businessman and recruit a practitioner and put in a business. They can give you, so you can open a clinic in Maryland, in DC, in Delaware, in any other state without fulfilling all those conditions. I want to say something here. I'm trying to say something so that my opening a private clinic, contrary to what we all know and contrary to what we have been thinking, is not reserved only to the licensed people. It's not reserved only to nurse practitioners. If you want to open a clinic, a behavioral health clinic, it is not limited only to nurse practitioners or to psychiatrists or to medical doctors. You and I, who are not, those of us who are not clinicians, can also have a clinic, but on one condition: you must have somebody who adheres, who accept to come and work for you as your clinician. If not, you cannot. But a clinician can just go straight with their license, and they apply for their Medicaid, and they get it and start practicing. So you can operate an outpatient clinic. They call it in Maryland OMHC, outpatient mental health center or clinic. I don't know the exact extension of the C. Outpatient mental health center in Maryland, without being a nurse practitioner, without being an LICSW, but you must have one on board. And the more you have, the more you can see those clients. So you can gather your money as an investor, any size, go. And the second advantage is that you don't need an office address, contrary to the behavioral health that you need an address that needs a fire marshal inspection and a certificate of occupancy, you don't need to own such an address. In DC and in Maryland, you can open a clinic without being a clinician, but just have it in mind that you must be ready to have a clinician who will work with you. Questions?
Question.
Yes, I have the answer.
What does it take to be the LICSW?
Okay, thank you so much for your question. It requires for you to have a master's in social work, and then you go in for the MSW, which is like a transitional certification. After that, I think you take the board, you operate as an LGSW, that's licensed graduate social worker, for about 2 years before you become licensed independent clinical social worker. So it's a process that takes some time, but you must obtain a master's in social work or mental health. I don't know some boards do accept. I don't know if mental, but generally it's masters in social work. Once you have your masters in social work, you are good to go. You follow the stages. You become an MSW, after MSW, LGSW, after LGSW, LCSW, before LICSW. LI is the topmost position because you are independent. The rest will need the supervision of an LI to operate wherever they are operating. I don't know if I've answered your question.
Sure, thank you.
All right. So, I think it's
Okay, I have a
already,
question.
yes.
Yeah, when you talk of operating without an address, I don't understand. Can you
Without a
tell?
physical location, sorry, I did not say it well. Without a physical location, if you want to do PRP, for example, that's the psychiatric rehabilitation program in Maryland, you must have an office space that you are renting, where they'll give you the lease, which you use to do the certificate of occupancy, to prove to the world that I, Miss Julia, is the occupant of this office, and no other person occupies this place. PRP, you must have that office space, which will be inspected and approved by the state. But with the type of license that I was saying with the clinic, you don't need that space. You can use your home address at the beginning, do it. When you grow big, you then go and get the office space. So I was not actually talking about address. You must have an address to operate the business. I was talking about the facility that will lodge the business. Behavioral health, you need a space that you rent, and you can rent it for 5, 6 months, 1 year without even receiving a dime. But with this, you can use your home address at the beginning, be doing telehealth services, and as time goes on, you can then get an office. Have I answered your question?
Yes.
Yeah, I think it was just a mistake. You must have an address, but I was maybe talking about office space. I don't know. It is 5 minutes past 8. This was scheduled for 1 hour. Should we continue or we should stop? Please write
I
your
have one
names.
last question in case we are continuing.
Please write your names in the chat box. Your names, your email addresses if you want us to continue, because the next session will be more interesting. We'll have other people that will talk. Yes, go on.
What insurance are we required to get insurance for for protection of the business?
Yes.
Or it's not?
Yes.
What
Must.
insurance is prescribed?
Okay. Thank you so much for your question. There are so many insurances. It depends on the type of business that you are doing. But there are three insurances that are always advised you to have. The first is professional liability, especially when you have professionals in your business. Professional liability, it is a license that protects people that are professionals. When there is something, that insurance can protect their license and save their lives. And the general standard is 1 million, and then an aggregate of 3 million. I always advise you to have that range. Don't go below. When I say 1 million is a coverage, ladies and gentlemen, it's not how much you pay, because I said it to somebody. I said, where will I get 1 million from? That's how much they can cover in case of a scenario. So most of the licensing bodies requires you to have average of 1 million and then aggregate of 3 million, but I think it can cost you about $700 a year to get that coverage. After the professional liability is a general liability, same bracket. It's always good to have your professional liability, general liability, which covers everything in the business. The next is workers' compensation, especially if you have anybody that is on W-2. It's always good to have workers' compensation insurance. The other insurances like cyber, auto, which will then depend on if it is being required by the state. But generally, as a business operating in healthcare, please have your general liability, professional liability, workers' compensation, cumulatively will not cost you just about $1,000. I can refer you to an online marketplace, Bees Insure. Bees Insure is an online marketplace for small businesses where once you go there, it's free of charge. You put your information to search around and match you up with insurances that meet your budget and what you're saying. So the secret is when you are doing it, please don't call huge figures. Don't tell them that you have 20 staffs. Just say we are just two of us. And then that's off the microphone. So you need an insurance. Any other question?
So, all
Is
right,
it the same insurance
what's
that
the
the
name? What's the name of the site you said for the insurances?
BIZINSURE.
BIZINSURE.com.
Beesinsure.com.
Businessinsure.com.
BIZ.
Thank you.
Yeah.
Yeah, business like business,
Like
business
business,
sure.
yeah.
Thank you, sir. Mhm.
Question?
Yes, I have a question. So what if the practitioners have their malpractice insurance? Do you still need to get an insurance for them?
Yes, that is for them. It is not for your business. You have other practitioners that might not have it. You have other people that can be dealing with the same consumer with you. The healthcare system in the United States, ladies and gentlemen, is integrated. We deal with integrated healthcare system where we have physical health, we have mental health, we have this. So as you are dealing with him, some other person is dealing. God forbid something can happen with the client, and at the end of the day, it's your insurance that will cover you. Their malpractice is for their license. It protects it's limited to their license. They will never export it to your business. They don't take it to your business. They protect themselves. They can give a wrong prescription, and it's the malpractice that will do it.
Okay.
And since he or she was in your company, your professional liability will cover all of you, including the client that was the victim. So whatever your clinician is bringing, it is theirs. Have yours. It's advisable. If you have just your clinic, outpatient clinic in Maryland, they will not require it. But you can go scot-free until the day something will happen to you. So in order to avoid the unforeseen, just get your insurance.
Yeah.
$1,000, I think, can cover the three main, or get at least professional liability and general liability until you are being asked to do it. Questions? Questions? So please write your names in the chat box. So as I was saying, if you have an idea, you have money saved somewhere at Capital One, you save 20,000, and at the end of the month, they'll give you $2 interest. You save 50,000, they give you like $5 interest. What's that going to do? Instead of saving that money, I'll advise you to invest it. That's what the Indians are doing. That's what the Jews are doing. Invest it in a business. Open a business. Think of a business. And as I said, healthcare is good because if you do it well, you smile. Healthcare is better when you don't do it well. Instead of keeping it and be proud somewhere, invest it in a business. I think if I had my slide, I could have displayed the 4 quadrants of business according to Robert Kiyosaki, where you have the E, the S, the B, and the I. E is employee, 9 to 5. You're bound to be there. S, especially small businesses, people that are struggling, like specialists like doctors, lawyers, they're under S. Small businesses like me, they're there. B are the big corporations, the Fortune 500, and I are investors. So when he talks of investors, he's more focused on financial investment, which I don't even have a clue. I don't know much about that. But I see investment here as you being in the E quadrant as an employee, saving some money to make to make a business that can sustain you. So I will say the goal of this webinar is to educate people to go in for businesses, is to let people know that if you have that idea, you have that money, and you are scared, there are people that ventured, went and failed so many times, learned, and are ready to share with you for free. But please don't think that if you come to me for a service, say to create something, I'll do it for free. That's where you will know the other side of Inspire Consulting. I'll charge you so well. So if you're interested to do a business, please do so. You can always come if you need more conversation, you can come and we'll advise you on what to do in any state in the United States. If you want to create just a business and you don't know how to go about it, come. Inspire Consulting is a registered agent in DC. I did not give details about creating a business because there are things like you must have a registered agent or somebody that has an address which you use as a registered agent. Those are things that are required by the law. Should have an address and things like that. Other questions? This was supposed to be an open session for people to discuss. Dr. Nomo.
Yes. Good afternoon, Mr. Mbui. I follow you from A to Z. In this webinar, your interventions are crucial, very crucial and deep. I know a lot of people here, like me, we have been nourished with a lot of informations. We really appreciate what you're doing. I don't have a big question. It's just that the people who are really interested to start a business with you, my question is, what if they don't have the means to start a business and they want to hook themselves with someone else who has a business, and they want to hook on with that person, to kind of like either work with them or partner with them? What advice do you give for that? Do you encourage such adventure or what?
Thank you so much. I think that's a very powerful one, Dr. Nomo. Yes, there are people who do not have much resources, but they have the energy to do. It's always advisable to partner with somebody. It's encouraging, and there are many ways to do it. Be bold enough to go to somebody who already have a business or somebody who is struggling with a business. You say, I see you're struggling with this business. I'm also very interested with business. We're doing business, we're doing this type of business. I think if we partner, I can offer this. So my advice is, before you want to go with somebody, go with something on the table. Don't just go with maybe your $2,000 to go and put it in a $100,000 business. Go with something. What do I mean? I had the opportunity to be in that position. I had the opportunity to be in that position. There was somebody who had his business. He has his business in DC and in Maryland. DC was booming super well, but Maryland was stagnant. He didn't even care about Maryland because DC was doing so well. So when I saw that, I went to him. I said, "Sir, I see you have a business in DC and Maryland. I want to revamp Maryland, but I don't have the means. I know I cannot buy it because you've invested a lot. You've paid your lease for 5 years and things like that. I have the knowledge, the capacity to run the business with the resources that you bring, and then we share the profits." Oh, that's fine. After all, I had abandoned it. Let's do 50-50. And that's it. So if you want to go to somebody for partnership, go with something on the table. Don't just go empty-handed. Either study or learn and know about that business and tell them that I don't have the money, I'm interested. Give me 5-10% so that I'll be doing X, Y, Z for your business, and you'll be giving me 10%. You'll be investing, you'll be paying all the bills, you'll be doing everything. I just want to scale and learn more in the business. That's the best way to do. Other means to do it is online. The online sites that you can go and seek for partnership. You have sites like Kickstarter, Indiegogo, or Kickstarter and Indiegogo. That's where you go and meet investors, angel investors, and all types of investors. And you can start interacting on Kickstarters. Even LinkedIn. Those of us who are fond of using social media, there are other social media that can lead you into the business world. LinkedIn is one of them. Twitter is one of them. Twitter is kind of selective. People who are business minded will always love to go to Twitter because it's kind of business. Most importantly, LinkedIn. LinkedIn is strictly for business. Even Indeed now operates as a social media because they have forums, they have instances that you can exchange. So if you cannot get it in person, which is always difficult, look for an online forum or medium that has investors. The best so far and the largest, the most renowned is LinkedIn. But you have sites that are reserved only for investors and people. So before going, have something that you go with. Have something that you will talk about. Have something that you showcase. And I think you do it to somebody, especially who needs your skills, who needs your resources. They will always say yes. They have never said no to me in such a scenario because I always go with the proof of concept. I can do this for you if you give me this. And that's how it goes. I don't know if I've answered your question, Dr. Nomo.
Of course, of course. The question wasn't directly to me. You know what I'm talking about. But now I think that people here have understood that if they are skillful, they can join uh, others who has already started something. I have my own, and I rely, and I want to appreciate Inspire Consulting, telling other auditors that here that is Inspire Consulting is my business operator. Is so if it's the publicity that I'm doing, I'll let it be because I know who is Inspire Consulting. Mr. Mbui is doing well. That's true. That's for sure. So when is the next webinar?
I think it's gonna be on a monthly basis.
Okay.
It's gonna be on a monthly basis, the last Sunday of the month. I'll
Okay.
look at my schedule and communicate on that. Thank you so much, Dr. Noma. I think I'll take everything you said as a compliment. It at least gives me the urge to do this because I'm doing it for free. I invested a lot of my time, resources to get this information that I'm sharing for free. And it gives me a lot of joy because tomorrow, if I see somebody somewhere doing well because of this information, that is my source of wealth. And that is how I have always been. I started this in Cameroon. Back then, I was working in the University of Chang. I'll gather students and will volunteer on things. And at the end of the day, most of them are well-to-do today. And that's my source of wealth. That's my source of riches. So I think we should end it here. It was scheduled for 1 hour. And I think if it went beyond 1 hour, it's because it was kind of interesting, hopefully. If you've not shared your email, please do so right now. Write your names and your emails on the chat group so that we can follow up with you with the subsequent sessions.
So thank you so much. I mean, this is quite, just like your company name says, inspire. I mean, this is quite inspiring. Like, I think that many of us here that, since we came here, you just have these ideas coming in and out and you don't even know where to start. So having a platform where you can have somebody pour out, their heart like this is nothing short of, I don't know if I should say miracle, but I don't know, you're just answering prayers. This is what we need. I mean, direction is one of the steps we should know. You can have all the ideas, but if you don't know how to start, if you don't know someone who has been in the field and has done things and have failed and is able to pour out their hearts, like, this is what I did and it didn't work, but you can do this, and this is what, I mean, God bless you and keep using you to inspire others. Out of this, you will birth millions.
Thank you so much. I'm inspired by your words. Any other comment, or I think we should end it here for today. I'll inform you about the next session. You're on mute.
Yeah, just to say thank you. Thank you. It's a wonderful initiative.
Okay. Thank you. Thank you,
Yeah.
everybody. I'll inform you about the next. Maybe either we continue with this, or I can share a little bit information about doing contracts and procurement with the government, which is something I also have experience with. Those are one of my business acumen is doing contracts with the government. I have about 3 ongoing contracts now, 2 in Maryland, 1 in DC, and I'm expecting about maybe 5 more contracts before the end of the year. But I failed for 2 years. I was rejected for 2 years in the contract world before making it. And when I had my first, it is now like non-stop. Any contract that I take my time and bid for, I get it. So along the way, we'll also talk about contracts and procurement. You can create a business and you start directly with contracts and procurement. But we'll finish with healthcare first before going into contracts and procurement, because those are other sources of income. The other topics I'll discuss on like 501c3 and other light. So thank you very much for your time, and thank you for the exchanges and everything. I'll keep you informed about the subsequent sessions, and please always get back to me if you have any question. I'm always open. It's difficult sometimes to get because I'm so busy, I would say, but you can always get to me. I'll always get back to you, even if it's late. It's just because I have this mindset of not saying no to people that people think I'm wicked. I'm not wicked. It's just because I am always needed, because I always like to solve a problem, even if it is to sacrifice another person's time. So bear with me. If you get in touch with me, I don't respond, I'll always respond. Catch me somewhere, I'll respond to you. Somebody wanted to say something?
Yes, I just wanted to say thank you for for the ideas you're sharing freely. It's not everybody that have that kind of mindset. But one thing about life is that when you see people succeeding, I think it gives some people get joy from it. So thank you so much. And also, is this something we can reach you privately?
Yes. Let me write my phone number on the chat box, so that.
And my second question, must you have any previous knowledge about healthcare before you can do this?
Nope. You just need the money and the courage and the guts. You get these people. In fact, just look for money. You don't need a proud background in healthcare. You just need to be an investor, and you are in business.
Okay.
Yes. I'm sharing my number in the chat box. If you need any further information on how to realize any of the things that we talked about, you can always reach out to me. Okay. Thank you, ladies and gentlemen. I'll leave the forum open again for about 5 minutes for those who may want to have private chats, but I will say we have officially ended this first session, and I'm glad there was this turnaround. There were about 30, the peak was about 35, which is not something I was expecting, about 20 people. So I exceeded my goal, and I think a message went through. Thank you so much, ladies and gentlemen, and see you in the next session.
Thank you so much.
Oh, Ms. Johnson.
Yes, sir.
You want to say something to somebody? This is Ms. Johnson, the owner of Abundant Grace Healthcare Services in Washington, D.C. One of the most renowned. I worked with Ms. Johnson for over 2 years before disappointing her. Ms. Johnson, say something to everybody. Inspire somebody, please.
Hi, Ms. Johnson.
Hi. Good evening, everybody.
Hey, good evening, Ms. Johnson.
Good evening.
First of all, I really want to appreciate Mr. Zhu for organizing this. You know, sometimes in the world of business, it is very, very difficult to see people who devote their time for others. You know, sometimes like he was explaining to each and every one of us, I think this is very, very encouraging. You know, sometimes you want to do something and the energy is there, you have the strength, you have the wisdom, but something, that spirit of fear is in you, and you disqualify yourself before even you start. But the journey is not easy. But when you come across somebody like Mr. Zhu, he's a very outspoken somebody and very bold. Like he was saying, where he gets his resources, or if he questions anybody, read. Everything that he was giving us is not just trying to convince us or trying to talk about business, but that's who he is. In our agency, we experienced some issues, and Mr. Zhu was like, you know what, that office, I think we need to go there. And I mean, not to exaggerate, this is an office that everybody is afraid to go, to be honest. Yes, the DC Healthcare Finance. And he said, no, Ms. Johnson, I'm just sick and tired of hearing these people. They are writing you, Let us go there. And Lord and behold, we went there and it changed everything. It was just a lie that they were putting on the company that were under investigation. Only when we got there, we discovered that there was no investigation. There was nothing. Somebody can just sit somewhere and lie on you, and you sit there claiming that you are down, you are this. But if you have both people like Mr. Zhu, who is not afraid of going somewhere and asking questions, he's just going to go. Tell him, I think even in the presidency, he will go. So you need people like this around, and I really, really appreciate him for doing this. I was really trying to see how it's gonna go, but everything that we have heard today, let everybody take it, and in your little area, just try to figure out, contact him if you need any help. Zhu is very, very, very helpful. Yes, very, very helpful. And he's a very, very smart and intelligent man, bold, that no matter the situation, he's not going to take no for nothing. When we're trying to get our joint commission, he went on it, and in the space of no time, we were done. We had our joint commission accreditation. And many people were there calling me back and forth, and how our people sometimes, they just like to hear, I don't know the type of name that they want to hear before they can run. When we hear our own, we take them for granted. Yeah, because I sent 2 or 3 people to him and they didn't even call him, just because they feel like, I don't think he would do it. Yeah, because you disqualify the person before going to that person. Just like when I started too, and everybody was like, oh, your company is not going to go anywhere. I don't take no for no answer. Even if you're going to shut me down, I will start before you shut me down. So you have to have that spirit in you of doing. If you don't know, now we have a great man right here ready to answer your question, and that's who he is. Any question you have on anything, trust me, ask him and he will tell you. If he does not know, trust me, he will read about it. Give him a couple of days, he will come back to you. So thank you so very much. I just wanted to add this, so let us know exactly who we are talking with and why are we on this platform. We are not just here to come and hear and go and sit down. Hear it. It might take you 1 year or 2 years, but get good information and get yourself together and do something. Thank you.
Thank you so much, Ms. Johnson.
I have a word.
Okay.
I know the good evening, everybody. My name is Julia. I cannot let this seminar end without extending my words of appreciation to Mr. Zhu. Like Ms. Johnson is saying, and all the other people have spoken, he is selfless. He's intelligent and knowledgeable and always ready to give, always ready to sacrifice his time, even if it means sacrificing another person's time, but he is ready to serve us. I have experienced his assistance in so many ways, and I cannot let this occasion pass by without telling him that thank you, Mr. Zhu, for your support for the group, support for the class, support for everything, for your knowledgeability. You go out of your way to make researchers because you want to help us. I really want to appreciate, and I pray that a good God will continue to give you the strength, continue to give you the passion for the people, because you are here tonight, not because you want to make money, but because you want to create an impact, of which that is what you are doing. It is a free seminar, but people will pay tons of monies to get this kind of knowledge. So I want to thank you so very much, and just keep doing the good work, and God will bless you and your generation. Thank you.
Thank you so much, Miss Julia. Okay, I think we should wrap up. I'm blushing. It's a lot of compliments, and I really appreciate everybody. I'll leave the forum open again if you need something, but I already shared my phone number for those who want to contact me for further information. Thank you so much for your time, and we pray that God should give us the capacity to keep doing this. At least somebody will get a message one day. Thank you so much for your time.
Good night.
Thank you so much.
Thank you.
And also, will this be shared?
Yes, I can share it or make it, I can share it.
Okay. Thank you
Okay,
so much.
that would be
Thank
good.
you.
So I joined late, and I just want to, listen to it again.
All right, no problem.
Thank you so much, Mr. Zhu.
Oh, Miss Adibe, I know your voice.
Thank you, sir. I know. We really appreciate. That was a lot of information. God bless you.
Thank you so much. Miss Johnson, I think you want to know Miss Adibe. You want to meet with her.
Hello.
Yes, I think you should meet with Miss Adibe.
Okay, definitely.
Please.
I'll call and schedule an appointment. Thank you.
Okay.
You're welcome.
You're welcome.
Tazu will give you my number.
All right. Thank you,
I'll do
Ms.
so.
Johnson. It's a pleasure.
Yeah, thank you. We're a family, so
Yes.
let's encourage one another, and when we meet, please let us sacrifice and give our best, because some of those out there I'm not going to mention, they really don't care about us. So if we can be strong together and form a great team, it will be very successful.
Yeah, very true. I agree with you.
It will help. Let us learn to admire our own, like what he's doing right now. Like he said, if he's doing this for free, let us not just take this for granted, because sometimes if it's a seminar that they are saying $200 before you join, people will pay fast.
Yeah, that's true.
When you see your own, you'll be like, what you are even go here for this? What you are even doing? What you are even get out for this? I'll leave me that thing. Yeah, but
It's true.
if we see another color, we'll jump. At the end of the day,
especially another color.
That's right.
That's true.
Let us just say it.
Well, you see.
Let us start learning, because even in DC where we are, it's like a field of lion and tigers. You think they like you? Think again. You think they like you? So you
They
see a
don't.
brother, instead of coming together and say, "Hey, my brother, this is what I'm going through. Or can we just figure this together and look for for the best route?" Who would have been so far today? I'm just praying that this generation, the younger people, will learn this and correct it.
Yep.
So if you see your sister jumping in a hole, you be able to stop and say, hey, Miss Johnson, hey, that we can do it this way, this way, this way, and then we come together and correct it. Don't see your brother going down, then you are happy, you know, to share that message, that bad news. You are sharing it. You are so happy to tell people, oh, did you hear what happened to Mr. Zhu? But yeah, that's the person that was giving you something for free and you were so happy. Now he's down. You can't even call. You can't even feel. Say, oh my God, I don't even know how he's doing now. Okay, something bad has happened. Can I support the wife? Can I support the children? Let us start doing that, you know? Let us not just be there to spread bad news, because we are doing a lot. We sacrifice, we come in our homes, we have a heart, you know, just see where we're coming from. See where we're coming from. Somebody shows up in your house late at night, 9 o'clock night, from a journey. You still get out of sleep, wipe your face, excuse me, and go and look for something for them to eat. That's what we know. Family. Family. But today, what has happened? That you hear that your brother has a problem. You are so happy to share the bad news. But don't you think that that person did something wonderful that has not been recognized? You know, if we can start learning to be together, form our groups, not just groups for free, groups that we can come together and encourage, not just empty words, but financially. Let us think that man that is sitting down and putting all this together, is he gonna wanna do this again next time? What are we doing? Let's come up with something, put a little price on it, so that even when you pay like that, you come and you know that the resources that you are receiving, you put it in action. You do something, you know, that will benefit you. So, thank you.
Thank you so much. I think the forum is
Thank
open
you.
for networking. We have CEOs here, we have clinicians, we have, you might get a job right now. Ms. Johnson is a big recruiter. So the forum is open for anybody. Ask your questions, get in touch with people. If you don't know, I know most of the people that are on this call right now, the people that are left. So if you want me to connect you with somebody, just let me know. But the forum is open for networking. Let's leave it open for about 10 minutes and then we close it. Thank you so much. I think we have a participant from Canada. And someone from, oh, this webinar is international, though we mostly focus on the US. All right. Thank you, everybody. It's 8:40 today, Sunday. Tomorrow is going to be a busy day. I think we should end it for now, and just stay open. I'll announce the next session. I think it's going to be, I'm seeing something like the last Sunday of the month, the last Sunday of March. I'll secret an Eventbrite link and share it with everybody. So encourage people to come and join. This is free service. This is my own way of thanking God, because people have horrible stories in the US. I never had one ever since I came here in 2019.
Evening
And
Zoo.
oh,
It's Marbury from Canada.
oh, Marbury,
Yes.
how is Canada today?
Fine.
How is the healthcare
Yes,
sector in Canada?
we're there. We're waiting for you here to come and set up. We're struggling to to study the system.
Okay.
As you said, I'm happy, even though I entered a little late, but I'm happy for the initiative. And I appreciate you like usual. These are things you started way back when we were together in Chang. And it is evident that you had to grow like this with the kind of open-mindedness that you have. We appreciate you. And I'm glad to have had a son like you.
Thank you so much for your blessings.
Yeah.
Okay, I think we should wrap up, and I wish everybody a blessed week next week. Thank you for your time. I really appreciate it. Good night,
Okay.
everybody.
Good night.
Yeah. Bye now. Bye bye now.